Good morning. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. We'll be live streaming surgery throughout the day today. Our first case, she travels here from Colorado. She's well known to us, and it's, by the way, Tuesday, June 17, 2025. Take a look at her x-ray. You can see on the x-ray of her lower back, she's had an artificial disc put in. Now, we did not put that artificial disc in, but her case highlights one of the complications, actually two of the complications of artificial disc surgery. Number one, the artificial disc can slip out of the spine after the surgery like this one did. Can you guys see the little teeth on the artificial disc there? Those are supposed to be all the way back to where the arrow is. So it's moved out about 3 centimeters, and it was at risk of popping out in her belly. So she called me and said, help me. So we went in the back and we did a fusion, because that's the salvage procedure, is to fuse. The alternative would have been to go through her belly again, which would have caused complications in her abdomen, such as bowel perforation, arteries and veins being torn open and bleeding profusely, abdominal infection. So we avoided all that by going through the back and doing a fusion in the back of her spine. You can see the bone graft and the successful fusion behind the cage. Jordan, show that. Yeah. Go behind the cage. Behind the artificial disc. Right there. That's all bone. So her bone at L4 grew down to L5 with our fusion, and that is one of the complications of artificial discs, folks. They pop out of your spine. You do not want artificial discs. I strongly recommend against them. If she knew about us earlier, she would have had the Deuk laser disc repair. In addition to a failed artificial disc popping out of her spine, she also developed what's called adjacent segment disease, which is problems above and below her fusion and artificial disc at L4-5. She now has a disc herniation at L3-4, which is what we're fixing right now. She also has facet joint pain on the left side at L3-4 and L5-S1. So the story here is avoid invasive surgery, come to Deuk Spine, get the laser procedure done, avoid invasive surgery, avoid the complications of invasive surgery. If you have questions, feel free to ask me. After we're done with the disc repair, we're going to focus on her facets and her top of her SI joint. Shot? All right, Henry, let's show the audience the 30 different causes of back pain. I'm Dr. R. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Welcome back. You can see from our video there are about 30 specific causes of back pain. Deuk Spine Institute has discovered all 30 causes and, more importantly, how to diagnose them. Now, Henry, can you see this x-ray?
Yes, we can.
Take a look at this, folks. Jordan, show the audience the artificial disc that's popping out of her spine that we had to fuse the spine for. You guys see that thing? Show the middle of the spine. That's the middle right there. That little nose right there is called the spinous process. Look at how the artificial disc is not just popping out forward, it's also popping off to the left side. So it didn't just move out forward, it also moved to the left. That is an artificial disc that's failed to stay in place. It's literally popping out of her spine. We had to fuse the spine to stop it, and the fusion worked. Now it's not moving anymore. Take a look at those clips at the bottom of her pelvis there. The surgeon that did her artificial disc had to basically sacrifice or eliminate her blood vessels in the front of her spine. Those are hemoclips. They're used to basically sacrifice veins and arteries in the front of the spine to do the artificial disc. So those surgeons that do artificial discs are literally destroying your normal veins and arteries just to be able to put an artificial disc in. And artificial discs are dangerous. We don't recommend them. They pop out like they did in this patient. All right, we just tested the L3-4 disc. Remember, she has adjacent segment disease from the artificial disc, and she has 10 out of 10 pain, and it's concordant. Concordant means that that is the same exact pain she has every single day. So we're inside that tear in the back of the disc. Thank you, Luis. And I'm going to remove the needle. I'm going to place what's called the dilator, which is actually a tapered tip that slides down the guide wire. We're going to go transforaminal through the foramen, and we've already put some numbing medicine, and I tested her disc, by the way, while you guys were watching your video. Guess what? She's got 10 out of 10 pain at L3-4 when I did the evocative discogram. And she said that that is her typical pain she gets every day from that area. But remember, she has more than just disc pain. She has facet pain, as well. So we're going to fix her disc with the Deuk laser disc repair. So we're not doing any fusion. We're not putting any metal in her body. We're actually just going in and cleaning the tear, which is where her pain is coming from. The pain is coming from a small tear in the back of the disc, and that's what we're going to go fix. Now, it turns out, if you watched our video just a minute ago, that 85% of chronic back pain, which is back pain that lasts more than 2 weeks, 85% of that pain comes from disc injuries. That's why she had the artificial disc put in, because she had a painful disc. She just had the wrong surgery done. Now we're going to go inside the tear, and we're going to use a laser to clean the tear. Now, Henry, show us, why do disc injuries cause so much back pain for people? What's the mechanism by which a disc injury, such as a herniated disc or bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, how do those, which they're all the same thing by the way, how do they cause so much back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, you can see from our animation that what happens is people get an injury to their disc, and the way that happens is through what's called trauma. Trauma. So falling down, or a sports injury, or a car accident. There's so many different ways to have a traumatic injury to your lower back. But once you have that injury and you tear your disc, you may not have pain right away. You won't have pain right away. You won't have pain in your back when you tear the wall of your disc until you get what's called a herniation. Once the jelly just inside the tear in the wall starts to push through, okay? Once the jelly starts to push through into the tear, that's when you get the inflammation. Who made this discovery? I did at Deuk Spine Institute. This is about 20 years ago. And we've even published our surgery results called the Deuk laser disc repair. It's published in PubMed through what's called peer review publications. The results are excellent. They're even better now. We've actually managed to perfect the technique over the last 19 years we've been doing this. And we've got it to where if we diagnose you with disc pain, we can get rid of 99.6% on average. Now that's patient-reported outcomes. What that means is we don't tell the patient how much pain relief they got, they tell us. We ask for what's called a percentage of pain relief. So we will take our patients after surgery, we'll basically point to where their pain was on their back or neck, and we'll say how much of that pain that was here is actually gone. And they'll tell us a percentage. And if you take those percentages and add them all up and then divide them, then you can get the average pain relief, which is 99.6%. I'm going to take questions in a moment, but I want you to see this is the tear at L34 right here. You see the blue stuff, that's the dye we injected with the discogram. It's called the Deuk Spine dye. And that dye will bind to and stain, we call it staining. It will stain herniation, herniated nucleus pulposus, but specifically the nucleus has to be not just herniated but degenerated. The way it gets degenerated is through inflammation. So if you think about it, you get a tear, there's no blue stain yet, then you get the nuclear material from the center of your disc pushes out into the tear and starts up some inflammation. Once the inflammation gets started, that inflammation changes the chemical nature of your nuclear material and it becomes degenerated. So you get degenerated disc as a result of that inflammatory process. That degenerated nucleus is what stains blue with the dye. And the reason we do the stain is so I can see the tear and I can see the herniation. It makes it easier to remove it. Now we don't use a whole lot of the dye, we only use a little bit. All right, Henry, before we take our first question, let's just show the audience how this surgery, Deuk laser disc repair, is the only surgery in the world approved to cure back pain coming from a herniated disc or degenerated disc. How does it work, this surgery?
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see how we repair these tears with a laser. By the way, that is the laser fiber at 12 o'clock. You can see it moving around. And I manipulate the laser fiber with my fingers. I move it around to actually remove the pathological tissue, the tissue that's causing all the problems. So in her case, her tear is at L3-4. We tested it. It's causing 10/10 back pain. It's her typical back pain she gets every day. I asked her because she's awake for that part. She's asleep right now. This would be too painful for the patient to be awake during the laser part. But before we started using the laser to clean her disc, I asked her how much pain the discogram caused, and she said 10 out of 10. And I said, is that where you get your pain every day? And she said, yes. So when patients say, yes, that's where I get my pain every day, we call that, the medical term for that is called concordant. Concordant. It's a weird word. I didn't make it up, but that is the, commonly used terminology when you've identified the patient's regular pain. Now, concordant pain through discography has been around for a while. Some doctor much smarter than me figured out that the discs do cause pain. They just never understood how they cause pain until I figured out it was the tear and inflammation in the tear. And like I said, that was about 20 plus years ago when I made that discovery. So it is this tear right here that is the source of discogenic back pain. But we knew, a few doctors knew back then, that discs did cause back pain, and the procedure called a discogram was invented to test the spinal disc to see whether or not it was painful. All right, I think we've covered a lot with our videos, and now we're going to take some questions, Henry, from our audience.
First question coming from Eddie on YouTube.
Hello, Eddie. Welcome.
Asking, how long until you can play golf after surgery?
Eddie, great question. It all depends on what surgery you're having done. If you're having surgery at Deuk Spine Institute, like the Deuk laser disc repair, you're going to be able to get back to golf faster than any other treatment in the world. And you'll be pain-free because our treatments actually cure back pain. You don't have to keep coming back for more treatment. We will cure the pain at the source like we're doing right now. This is the L3-4 disc for this young lady. And when I do this surgery, the pain will be gone from this disc. It'll never come back unless she, of course, re-herniates, which is very rare. About 1% of our patients do re-herniate, 1%. It's 1 in 100 will re-herniate. They'll do something they're not supposed to do and push out some more herniation into the tear, and then it'll prevent the tear from healing. But to answer your question, it all depends on what surgery we're doing for you and how many discs and what the discs look like. I have some patients that go back to golf within days, and I have other patients that take longer. It just depends on how many discs, what the condition of the discs are, and a lot of times I have to get inside the disc like I am right now and look at it and see what it looks like on the inside to be able to tell how quickly it's going to heal. We're almost done. I'll take some more questions, and then we're going to move on to our second procedure for her, which is our facet joint treatment. We're going to broadcast that as well.
Next question coming from Mark on YouTube,
Hi Mark, welcome to our live stream at Deuk Spine.
asking, can cement be used in C0 to C3 for craniocervical instability?
Yeah, there is no cement that can be used for craniocervical instability. The cement that Mark is referring to is called PMMA. It's methyl methacrylate. It is a sister product to what you all know as super glue. Super glue and orthopedic cement are almost identical. Just orthopedic cement is a little bit thicker, and it's designed to be used in the human body. So cement cannot be used. It will fail. It will not work. You need to fuse. If you're going to stabilize the spine, you must fuse. Fusion means you're taking the patient's own body and using the patient's body to stabilize this part of the spine by causing the patient to fuse the bones together. That's what a fusion does. It stabilizes through fusing bones together. I would not use cement to do that.
Next,
Great question.
next question coming from Sandy on YouTube,
Yep. Sandy, we'll take your question.
asking, have any of your patients reported a symptom of internal vibrations / buzzing sensation throughout their body that have disc, facet joint, SI joint, or any other spine-related issues?
Yes, patients do have, some patients, not all, and just very few, will have sensations throughout their body, okay? Remember, every human being is wired a little bit different, okay? That is the God's honest truth. So we're all a little bit different, and we're talking about millions and millions of signals transmitted along nerves from one nucleus to another or one area to another. And those signals they're all interpreted by your brain at higher levels, cortical levels typically, or subconscious levels in the brainstem. And those sensory signals can be interpreted by your brain differently from you versus somebody else like me. And so yes, those can happen. It's not common, but I don't write it off as being unrelated. I've seen people with those type of symptoms get better as long as you're treating the right source. I hope that answers your question. I don't know. Luis, what's going on here? Huh? Too much machismo? All right, we're just about done here. This is L34. So far, she's doing phenomenal. But remember, we're doing more than fixing the L34 disc, which is just about finished. We're also going to be fixing her facets and probably the top of her SI joint. But we're pretty much done. That whole herniation is now gone. I've used the laser to clean it up good. You can see some epidural fat. That means we're done here. If I look to the left, I might see a nerve root. Nope, it's hidden in that fat right there. I'll probably take just a little bit there. There's a little bit of inflammatory tissue right there. I want to zap that away. It's just underneath the nerve root. I don't know if you guys can see that pinkness there.
Yes,
Any
we can.
other questions?
Yes, we have a few more questions. Next one coming from Lanu on YouTube,
Hi, Lanu. Welcome.
asking, is there a success / failure statistic for artificial discs?
That's a great question, Lanu. Great question. Well, the best way for me to answer that is to say that it really depends on the surgeon and their surgical technique and the type of, let me just do a little bit more, and the type of artificial disc they're using. But it's a lot of it's surgical technique, a lot of it's patient anatomy, appropriateness, and then some of it's biomechanical device related success and failure. Here's the thing. I'm going to tell you the truth. Okay? The data, in my opinion, this is my opinion, the data that you are all seeing from the FDA trials and the peer-reviewed publications with the results of artificial discs have been manipulated by the companies that sell them and the doctors and surgeons that work for them in order and get paid millions of dollars to do their dirty work. They have manipulated the data to make it look like artificial discs are great and have great outcomes. They've hidden the complication rates from the public. They don't want you to know about all the complications. It is a massive scam. I'm aware of it. I saw it early on. I tried to raise awareness about it, but there's a lot of badness right now in spine and healthcare, and artificial discs are just one example. All right, we're done with this disc. We're going to move on to the facets. Any other questions?
Yes, we have a few more, but this next one is from Mark once more on YouTube,
Yes, Mark?
asking, can ACDF at C4 to C7 fusion be undone at your office? My upper cervical spine and brainstem is all moving excessively.
Yeah, so first of all, ACDF can never be undone by anybody. I would never recommend it. There's nothing wrong. ACDF doesn't cause pain. It's the complications and adjacent segment disease that does. So what can we do? The best we can do for you, my friend, the only thing I'd ever recommend is get us your new MRI and CAT scan. Let us do a review with you. The review will take 10 minutes. You can do it from the comfort of your home. It is free. I don't even charge you any money for me to spend my time and figure out what's wrong. At the end of that, I will tell you exactly what's wrong, and it's not the ACDF. It's something else, either above or below, or both. And we can fix that for you easily with a very minor procedure at Deuk Spine. So if it's relief of symptoms you're looking for, we can do it. You don't need to undo your ACDF. Next question.
Coming from Ahmed on YouTube,
Hello, Ahmed.
asking, Doctor, are you treating cervical myelopathy? I have big disc herniation at C3 through C7. Corpectomy is a dangerous operation for the cervical disc from C5 through C7. The neurosurgeon proposed that to me, but I refused.
Yes, my friend, I do treat cervical myelopathy, cervical stenosis, cord compression, cord dysfunction. Yes, I can help you. And if it's a herniated disc, I can remove it with laser. You do not need any fusion. It will be laser, and you will have your normal discs when we're done. You just need to do an MRI review with me. It's free. You can do it from your home. Henry, put the link for the MRI review, please.
Copy that, or read it.
All right, we're going to end this stream, and I'll come back with our